Welcome back to Open Your Eyes. There's been a new virus on the news making headlines internationally, and we thought it important to bring it to the public's attention. We are going to take this next portion of the conversation to further understand the Nipah virus. And to help us with that conversation, we brought with us Dr. Hidalgo. He is, of course, a medical practitioner. He has been here several times speaking on various medical topics as well. Good morning, Dr. Hidalgo. Happy to have you back.
And good morning, and thank you for having me. One more time.
Yeah, yes. One more time. Hopefully not the last time. But perhaps we can begin with a quick breakdown of what the Nipah virus is. I know I first heard of this virus on the news where they were connecting it to a widespread in India. But is that where it originated from? Where is this virus coming from?
Yes, well, I think so. First of all, we want to just to ensure the population that this is just an informative conversation. We don't have no cases in Belize, and hopefully we don't. It's just to create awareness.
Yes.
Well, the Nipah virus is not as new virus. Actually, the first cases of Nipah virus were reported in Malaysia in 1998. The first outbreak happened in a pig farm, and at that point also some cases went to Singapore.
Doc, for the benefit of our viewers, explain to them what is the Nipah virus, how it's transmitted, and so on.
Yes, and I'm going to that direction just to give you some background of how to initiate. But the Nipah virus is one of the virus that we call it RNA virus. And what is important to us to understand is that those viruses have the ability to mutate. So far, it's not as bad as COVID, but eventually that's one of the concerns that we have. If this virus starts to mutate, it's going to increase its transmissibility. So far, the carrier of that is that we call it the fruit bat, or the foxes and bats that lives in that region. And what is normally happen is that the people in that area, they like to consume this type of liquid from the dams, from the trees. And they usually go to the top of the tree, make a cut, put a jar to get the swamp, and then during the night, the bats go and they pee, or they get saliva there. And in the morning, when the people collect the jar,
with water,
it's already contaminated. And in Malaysia, this also the fruits get contaminated with saliva and the feces of the bats, and the pigs start to eat it. They get contaminated, start with flu symptoms, and they essentially transmit that to humans. In the case of the bats, it's also drinking the raw liquid from this.
So it's what we would describe as a zoonotic.
It's a zoonotic type of infection.
Yeah.
So this is it shows its symptoms in flu-like, in like a flu-like symptom.
Yes. Right? But also the concerning part of that is that you can have like a flu-like symptoms, but the most concerning part is also that it can affect your brain. It can lead to encephalitis. That means that the brain get infected, get swollen, and the patients initially can start only with some like flu symptoms, with cough and fever, and ended in ICU with respiratory conditions. But other group of patients can start with confusion. They can present it with seizures, and as similar ended into the ICU with a bad encephalitis case.
Now, I imagine viewers might be asking, if there are no cases in the country as yet, why are we using this opportunity to spread awareness? We know that there has been an outbreak in India, as you mentioned. This has the Nipah virus has been around for several years, for decades. However, it has returned and has been spreading in India primarily right now, where it has been making headlines. In Belize, we have quite a large population of Indians as well, who I imagine travel back and forth to the country. And so that is one of the primary reasons why we are using this opportunity to spread awareness on the Nipah virus. My next question is, are there vaccines in place that we can potentially use to protect ourselves from this virus?
Yeah, that's the next thing. So far, there are no vaccines available. There are no treatment available. There are some experimental treatment that they are using. We call it monoclonal antibodies, that, but unfortunately there is no treatment approved and no vaccine approved. As we are speaking, of course, the WHO raised that concern, and there are people working on trying to develop a vaccine in case of a potential pandemic. But hopefully no.
Is there a fatality rate of this virus?
That's the next thing. The fatality rate for Nipah virus is 40 to 75%. 25 more fatal than COVID.
Wow.
The advantage is that it's less transmissible than COVID. COVID is more transmissible.
Yeah, airborne.
Yes. And the other important thing is the incubation period. The incubation period varies from 4 to 15 up to 21 days, and in some cases they say it could be up to 45 days. No, I mean that someone who probably travel to a region, get exposed, they get the condition, they travel back to different areas, and start to develop symptoms. No?
If there's any silver lining, in a manner of speaking, is that with modern medicine, we've been able, and the COVID pandemic has been proof to this, we've been able to do research and, in terms of technology, come up with vaccines way quicker, much faster than what we've been doing in the past, where it took years, if not decades, for us to arrive at a vaccine for certain infections and what have you. Do you believe that now that the World Health Organization has been prompted to get involved, that it would expedite a vaccine?
Well, that's the what everybody expects, no? The advantage of this outbreak so far is that it happened ending of December, starting on January, where these 2 cases were detected and confirmed, and those cases were in a private facility in West Bengal, India. No? The good thing is that they managed to do all the tracing the contacts. They got more or less 190 people exposed to those 2 cases, and fortunately none of those so far has been tested positive. When they were quarantined and no one came back positive, the 2 cases that were confirmed in that facility, luckily they went to the ICU, but they survived. No?
If there are persons who are traveling at this time, as you mentioned, there are no vaccines in place, but they start developing flu-like symptoms, what are specific things that you should look for in terms of an indicator that you might need to visit your doctor and test for Nipah?
Yeah, well, the most important thing is, one, so far, all the cases were contained. The outbreak is, as we're speaking, contained. There are no cases documented outside of India. The neighbor countries of Asia, they definitely put all the different measures in place in the airport, because just to give you a very quickly and rapid background, all the countries that have Nipah cases in the last 20 years is Bangladesh. They have usually some cases on a regular basis. Malaysia, the Philippines, and Singapore. Those countries on Asia and countries on Africa that they have this type of bats, they put some of the countries already implement measures at the airport. But if we start to develop like flu symptoms, and we know and we knew that we already went to places where are potential for those Nipah virus, then they need to look seek for medical attention and see that they were to those places and that they will need to be tested for that.
So immediately after showing flu-like symptoms after visiting those countries, you would recommend for them to get a test. What does that test look like?
Coming back to COVID, no, the advantage with COVID is that the technology who is basically is available. We need to have the reagents, no. The PCR machines are available more in most of the countries due to the COVID. No, I mean that is the technology is there. It's just that if in case of we have an outbreak, then we need to have the reagents and the ability to test for that.
At this time, Doc, if there becomes a spread outside of these countries, would Belize be equipped and prepared for something like that to arrive in this country?
Well, COVID proved that most of countries, especially with the low and middle income countries, and even the countries we have all the technology, when we have a pandemic, usually the health system suffers, no, and then and we already experienced that with COVID, where essentially all even the most important countries with all the technology and resources, they get into troubles, no, and then of course countries like us usually are going to be in more trouble, and hopefully we don't reach to that stage that we need to have and the availability of those technologies. No? As I said before, no, this is a virus that essentially the treatment is just conservative, just general measure fluids, ICU resources if needed. No?
Which is really not that comforting to hear, but what are some measures that persons that may be traveling to these countries that have Nipah virus can take to protect themselves?
Well, the most important thing as a general, even if to protect for respiratory conditions, is that you need to, first of all, the common thing, to wash your hands with, and even if you don't have hand sanitizer, with water and soap, that's proof that it's effective. If you believe that you are traveling long way and you see people or you have people coughing close to you, wear your mask, or even if you are not that, but you are traveling to those regions, is reasonable and to as a general measure to wear your mask, you know, to prevent that.
Even though it's not airborne, and you mentioned that it's not necessarily transmissible from one person to the next.
Exactly. Even so that in crowded areas is usually one of the things that we need to have an additional precaution.
Excellent. Doc, I always value the opportunity to inform our audience, in this case the Belizean people, because we're also up against misinformation. And if one thing the COVID pandemic has taught us is how quickly misinformation spreads, right?
Yes.
So it's easier for us to present what we know factually about a illness, a disease in this case, as opposed to perhaps people doing their own research and coming up with their own theories.
Yes.
What's your take on that?
No, absolutely. The most important thing, and especially those days with the ability to us to go to the internet and get any kind of information, is best if we have objective information and at least ways to how we can direct the people and where to find information.
Yes, I think of also people who might be consulting Google, you know, simple Google or the internet to diagnose themselves too. You know, that is the reason why we have conversations like this, to inform you that this virus in particular is not present at this time in the country, and at least not in the region as well. As we wind down the conversation, Doc, do you have any final thoughts you'd like to share in terms of how we can prepare ourselves, again, when we travel, for persons simply in airports as well? You might not be going to Bangladesh or Malaysia or India, but you're traveling in airports, and it's also important to remember to keep yourselves protected from viruses there as well.
Yes, well, you know, you not only can contract respiratory condition. You can contract gastrointestinal conditions traveling to other countries. I mean that, as we usually say, the simple things that is proved that work, washing hands, hygiene are critical. Keep yourself well hydrated, drinking, of course, water from safe sources. And again, if you have exposed to, or you are traveling together with people that you see that are coughing, wear your mask. Trying to extreme your precautions. We already, in the last month or two, we've seen a lot of cases, and we discussed the last time this amount of cases of respiratory conditions, gastrointestinal conditions. I mean, that is just to emphasize how important are to keep those simple measures.
Yes. All right. Well, thank you very much for joining us, Dr. Hidalgo. It's always a pleasure having you here, and we look forward to having you again very soon.
Thank you.
All right, we take another quick break, but don't go anywhere. Our next conversation is about building future innovators with ITSAT STEAM Academy.